Here we are at Sharp Healthcare in San Diego with 7 hospitals, 2,700 affiliated physicians, and more than 18,000 employees. Sharp is driven by the Sharp Experience, which is the philosophy of treating people, not patients, and transforming the healthcare experience for our entire community. This is their centralized patient placement center, remotely located in their corporate office. While not large in square footage, it's huge on efficiency, productivity, and delivering on the Sharp Experience and mission every day.
It's nice because the way the room is set up, we can hear each other. So sometimes one person will have more information about either a particular hospital or something that's been going on prior, because we all move around. So we're not at the same hospital. We're at the same hospital for a week and then we change to the next hospital so we can keep up with all the changes that are going on within the system. And sometimes just being able to hear each other makes it more efficient. So we're not having to call each other. We just walk over to the cube and have a conversation. So they build out new floors, they change the way they do things. So we're all constantly getting new information about the hospitals, and in order for all of us to be on the same page, we rotate so that we're always, if you're one person in one hospital and then you go on vacation, then there's somebody who needs a learning curve. This way, there's less of that.
My name's Dina Smith. I've been working at Sharp Healthcare for 10 years, 7 years in the command center, in the placement center. I've been here since its inception, so I was here for the build, which was a great opportunity. It was really fun building the command center. My current workspace, I work here, and then I have one of our dashboards overhead. We have different dashboards that we utilize all through Sharp Healthcare. This particular one is our enterprise dashboard. So we place to 6 hospitals. And what's nice about this one in its current configuration, which we've changed a couple times as our program has evolved, but in this one, when I come in the morning, I can tell at a glance if we're going to be challenged. I can look at the number of people waiting either for a bed from our procedure areas or from our emergency rooms, and then I can look over and see how many confirmed discharge we already have, if the doctors have rounded, if we know we're going to have beds or not, and then I can look at our staffed beds versus our licensed beds versus our occupied beds, and I can get a sense of how the day is going to run. And over time, in the command center, we've really learned that certain configurations, we already know how our day is going to go based on what we see in the morning. Similarly, when you look at the transport average turn time since midnight and really the EVS turn time since midnight, if EVS is already behind in the morning or they didn't catch up from the night before, you can see how that has an add-on effect to the delays in your throughput in the morning hours. So that this is invaluable. Also, our command center is located in the corporate office of our healthcare system, and our disaster coordinator works on this floor. So she gets a call from one of the hospitals. They want to put up a disaster tent because a crisis in capacity. She'll wander over here and consult with us. Okay, how do things look? And we can show her. Yeah, things look bad, or no, if they just got their discharges out, you don't need to take these emergency measures. So it's been a huge boon to us to have these dashboards, and I wish I could say we planned it this way, but just by happenstance, my workstation looks up on the dashboard, and that's been a real nice feature, and we use it every day.
Hi, I'm Erica Robbins. I'm the lead bed placement coordinator here at Sharp Healthcare. I have been in the centralized patient placement department for 6 years, first as a coordinator and now as the lead. One of the things that I think is really unique about our group is we have a mixture of nurses and non-clinicians, and we are able to work together seamlessly in this environment. We're able to communicate directly through INs, whatever, but we're able to work together in such a small space, and it just makes it easier when you have the exact people that you need to talk to, and you don't have to pick up a phone to call them, that they're just there.
My name is Chantel,
And I'm Edith,
and we work in the centralized patient placement as the PAS side.
and we partner with the nurses to make sure all the patients are being admitted at a timely manner.
And we make sure that the patients are being, like their insurance is clean, and that we transfer the patients over when we get alerts from on site, and put them in their beds.
We tuck them in.
I'm Tia. I only been here for 2 months, but I work directly with the nurses with helping get the direct admissions into our facilities.
Hi, I'm Pam. I'm working at the transfer center today. I've only been here a little over a year, but I've seen a lot of changes transfer center wise since the pandemic started. We do get a lot more requests from out of county, out of our area for transfers into Sharp facilities. So it takes a lot more communication with our admins at the other facilities to communicate what requests are coming in and what's available, because it's changing, you know, minute to minute sometimes what's available at our different facilities. So
I don't know that COVID made that much difference in how we place patients other than where we placed them. The one thing that has really helped the hospitals is that prior to bringing it to a more central patient placement, the administrative liaisons, or they used to call them the head nurse, or the nurse in charge of the hospital, had to do all the bed placement, and that was in addition to handling other problems all over the hospital with patients, with floors and that sort of thing. So this took a lot of pressure off those people in administration.
Hi, I'm Diana. I've been working here at the CPPC for 3 years now. And there's been a lot of changes because of due to the pandemic, but everybody's been very helpful and everybody's been adapting to it. And actually, the tower has been a good change, a very beneficial thing that we've gotten this past year, because I can't imagine how Chula Vista would have been able to handle the pandemic if we hadn't gotten all the new private rooms. Because now we have to check with each charge nurse, although we've been doing that even prior to the pandemic, if a patient is appropriate to a certain bed. But yeah, so it's pretty effortless right now.
My name is Trisha, and I have been here a little over 2.5 years, and we just got an upgrade to our teletracking, which I really enjoy. The dark aspect here, the dark mode. It's easier on the eyes for me, and it's a really great upgrade. A lot of these upgrades have aided our processes a lot easier, making them easier.